Hey guys, it's Emily, your acupuncturist. I have a guest with me this week. If you've been into the office, you've already met Finn. He visits me once, 1 week every year when his mom goes out of town, and I get to dog sit him, so he becomes our clinic dog. But I want to do the next couple weeks a little series on fertility basics. I see a lot of miseducation or just lack of basic education about what it takes to get pregnant or to avoid pregnancy even, if that is your goal. So I just want to cover Fertility 101 over the next few weeks. The first thing I want to talk about is you cannot get pregnant every day of the month. I know that we're taught when we're younger that we are baby making machines and you just look at a woman and she gets pregnant, but that is not the case, unfortunately. The average woman with a normal menstrual cycle, meaning every 28 to 35 days or so, she's only fertile 6 days out of the month. That's the day she ovulates and the 5 days preceding ovulation. So it's really important to figure out when you're ovulating. Often that's about 12 to 14 days after the first day of your period, but it varies woman to woman, and that's why I teach women in my fertility program how to track their basal body temperature and their cervical fluid so they can know exactly when they're ovulating. And that leads me to my second Fertility 101 tip, and that is cervical fluid. So you might have noticed in your reproductive years, you get this seemingly random discharge that's like a white, hopefully sticky, we call it egg whitey consistency, and it's really not so random. It occurs around the time you're ovulating, and it's the medium that sperm can get inside you to fertilize an egg. Your vagina is acidic, and your sperm needs that alkaline medium in order to safely travel to where the egg is. So you'll start to notice cervical fluid, leading up to ovulation, and we want it to get to a consistency that if you put it between your fingers, you can stretch it to about 1 inch. That's considered healthy cervical fluid, and it's necessary in order for fertility to be at its highest, okay? So today, you can't get pregnant every day of the month. Typically, there's just 6 fertile days each month, the day you ovulate and the 5 days preceding that. And we need healthy, good quality cervical fluid for fertility to be optimal. So look for that towards the middle of your cycle to start seeing that discharge or cervical fluid, all right? Thank you for listening. Next week, we're going to bring you some more Fertility 101, fertility basics, so you guys can start learning more about your bodies and your menstrual cycle.